Are you struggling with erectile dysfunction? Today, we are going to discuss the science behind the two leading treatments, Viagra versus Shockwave Therapy. Hi, I'm Stephanie Wolf, the leading sexual wellness expert here in Studio City, California at the Novus Center. So the first thing I want to talk about is how exactly all of this works together. What I want you to remember is that your blood vessels have a lining, and it's called the endothelial lining. This endothelial lining produces something called nitric oxide. You guys all know what nitric oxide is. It is the most potent vasodilator in your blood vessels. But why it's important today is because this nitric oxide is responsible for promoting or releasing this chemical that's called cGMP. cGMP is found in the corpus cavernosum of the penis, and it's responsible for causing smooth muscle relaxation by way of inhibiting calcium from influxing into this smooth muscle. Whoa, I just said a bunch of words. Well, one thing I want you to remember is that calcium causes constriction, vasoconstriction of your blood vessels specifically. So if you're trying to get an erection, don't you want the most potent vasodilation to naturally occur? Yes. So the way that you do this is not only through means of nitric oxide, but you must have enough nitric oxide to produce cGMP. So there it is, cGMP. This is a very important chemical that's going to allow smooth muscle relaxation, and it inhibits your calcium from flowing into this smooth muscle so that you can have a strong, firm erection. Now what happens is, once you finish or ejaculate, you are then going to secrete an enzyme that will then inhibit your cGMP from causing this smooth muscle relaxation. And it's very important that we have this natural biofeedback loop and this homeostasis. Otherwise, you would walk around with an erection all day, every day. You can't do that. It's very unhealthy. So it's very important that you do release this enzyme that will then inhibit this cGMP, so that way you can go back to your natural resting state, flaccid state. Now what happens as we get older is our endothelial lining or our blood vessels, they become damaged and weak and tired, and they just don't work as efficiently as they used to. Whether that's because you have diabetes, or you have high blood pressure, high cholesterol, maybe you're a smoker, maybe you're overweight, maybe you're just older, quite honestly. So what happens is, as this endothelial lining becomes damaged or weak, you're no longer producing enough nitric oxide to then release enough of this cGMP. So if you're not releasing enough of this cGMP, you can't get this smooth muscle relaxation. You are not inhibiting the calcium from coming into the smooth muscle. So then you're not getting a strong, firm erection. This brings us to the 1980s, when Viagra was first invented. Viagra is called a PDE5 inhibitor. And the whole idea behind this was the scientists knew that this is happening as we age. Again, we're not making enough nitric oxide. So they said, if we can actually inhibit the enzyme that breaks down that cGMP and allow that cGMP to just float around a little bit longer, perhaps we can actually improve these erections, or perhaps we can maintain our erection a little bit longer. So that was the idea behind Viagra. And it's a great idea, and it works for some men, but some men it doesn't work. And I hear this all the time. They'll come in and they'll say, I've tried Viagra, Levitra, Cialis, all these PDE5 inhibitors, and they don't work for me. I don't know what's wrong. Why? Well, what's wrong is that your blood vessel lining is completely damaged. You're no longer making any nitric oxide, which means you're no longer making any cGMP, so you can't even get enough blood flow or smooth muscle relaxation to get this erection. So this isn't going to work for you, which is why option number 2 was invented: low intensity extracorporeal shockwave therapy. Shockwave therapy is going to actually trigger the body's response responds to create brand new blood vessels. It's creating these microcavitations or micro bubbles by the sound wave. The sound wave is emitted into the tissue, and this creates the little bubbles that says, hey, there's been some kind of damage down here. And this damage sends the signal to the brain to send down stem cells. And these stem cells specifically are looking to enhance and repair your blood vessels. It's otherwise known as angiogenesis, formation of new blood vessels. So when you're creating brand new blood vessels, you're now increasing the production of nitric oxide. And what did I say before? You need nitric oxide to promote this chemical release of cGMP in the corpus cavernosum. What does cGMP do? It's a smooth muscle relaxer. It's going to inhibit that calcium from coming into the corpus cavernosum so that you can get these strong, firm erections that last until ejaculation. And then remember what I said, after ejaculation, that's when your body's natural mechanism comes in and secretes an enzyme that will inhibit that cGMP so that you can go back to a flaccid state. So, two ways of treating erectile dysfunction: Viagra and shockwave therapy. Viagra, as we just now discussed, sometimes works for men and sometimes does not work for men. And I just told you why. But the other thing I want you to remember is that Viagra, just like all medications, has a tolerance, meaning the longer you take it, the more it doesn't work. The higher dose that you need, the more it doesn't work. So you will build this tolerance behind the Viagra. And eventually you're going to have to do shockwave therapy. As far as side effects go, Viagra does have side effects. I hear it all the time: flushing, nasal congestion, headaches, high blood pressure. Because remember what it's doing is it's keeping that cGMP around a long time. So it's allowing this vasodilation of your blood vessels so that you can have these firm, strong erections. But when you're having all this vasodilation, all this blood coming down, you're going to get this nasocongestion and this headache. This will then subside usually about 4 to 6 hours later. Whereas shockwave therapy, there is no downtime. There's no side effects. There's no pills. There's no surgery. You can have sex that day. Any side effect I do see from shockwave therapy is really from the shockwave itself, meaning it can break little blood vessels, superficial blood vessels, giving you some bruising, maybe a little bit of swelling or itching, but it's very rare. And if it does happen, it's usually gone within 24 to 48 hours. But again, no downtime, no side effects, and you're allowed to have sex that night. So that's your answer, my friends, between Viagra and shockwave therapy. If you want to learn more, give us a call here at the Novus Center.